tell you why we think it's the right thing to do, because we have had actually, just an example, we did a summer enrollment at Coosa Valley Medical Center on the south end, and had probably 200 and something individuals come, and many got affordable health insurance. We have had many that fell in the gap. And I'm going to tell you the story of one lady, and it breaks my heart that this could be the case. She is a mother. She's married. Her husband's disabled. She worked. She has 3 children. She worked in public health. She was a home health care. And she lost her job. We know why, because everything's downsizing. And she had good health insurance. Think about it. She was a state employee. But she sat with me one day, and she and I talked a long time about it, and it's very emotional, because she said, you know, I tried not to. She came to us, and by the way, she fell in the gap, and that's the reason it's very upsetting. She is working poor, and she has worked her entire life. And she sat in front of me, and she had blisters on the bottom of her feet. She was working at Captain D's, and she worked every shift, every time they called her. But she fell in the gap. She had no insurance. She talked about when she had insurance, she said, I didn't use it because I thought it was a privilege. Now, she was working on that insurance. And it's just a very heartbreaking story, and we've been working with her to try to help mitigate that situation. But again, challenges in the healthcare community. Realizing that if you're not educated, if you're low literacy, we have low literacy. I think about 20% of our adult population is at level 1 literacy, which means they couldn't read the back of a cereal box. They couldn't know if they got the right change, if they, used to be 25% though. It's dropped. But at any rate, knowing that education is the key, it impacts health care, it impacts wellness, it impacts that child coming to school ready to learn, all of that. We had an opportunity to really take some serious look-sees at taking the process that we've utilized in the past and building on that to develop some innovations. And we decided that we were going to apply for a federal grant that was very competitive. There were going to be probably about 16 awarded nationwide. And so we took our model. We tweaked it just a little bit, and I have provided for you the process we're using now to address some issues that we have identified. We had the opportunity to apply for rural. We're rural, and I'll have to tell you, if you are in a rural area, there are funds out there, USDA funds, HRSA funds, things of that nature that are out there to address issues related to the rural Alabama, rural America. And so we were told by some people that we had actually gotten some advice from about our application, and we said, don't apply, you're not going to be competitive. You can't compete with what's out there. Well, you know, if you know anything about the group that we work with, that was just like, okay, well, we'll see about that. And honestly and frankly, once we submitted this, and it was a very in-depth process, we sort of put it on the back burner and didn't really think we were going to be 16 awarded nationwide. And so the person actually that told us, she was with the, and she has worked with HRSA, and she's with the Georgia Policy Institute, Health Policy Institute, called me on the phone one day, about a year ago, and said, you got the grant. And I'm going, what grant? I said, no, we did. She said, you hadn't gotten notice? And I said, no. I went back to my office. I couldn't find anything on it. turns out we were one of 16 in the nation to be awarded this Rural Health Network Development Grant, $300,000 a year for 3 years. Now, what are we going to do and what are we doing? It's pretty exciting. We have synergized our county at a level. I've lived there all my life. I have never seen the level of engagement that we have going now. We have 4 and a community of practice, and this is, I have some handouts. Oh, let me get here. It really is something that I think you as educators, and honestly, I have to tell you that part of this is springboarded out of what Dr. Cobia did with her administrative group when she was superintendent in Sylacauga, which is a learning community. Duh, you know? It's not new news. This is a CDC model. And we selected this because it was very aligned with Together We Can. It was very aligned with the work and the process of collective impact, and we tied it to all of that. It's about putting the puzzle pieces together, and I can tell you that Dr. Kobe and I have been putting those puzzle pieces together for years. That's how we depicted what we do, is putting the puzzle pieces together. These puzzle pieces are directly related to healthcare, but they're not just healthcare. They're education. So we have basically 4 communities of practice, and I keep being told that we are being very audacious, that we are really biting off a whole lot. I have no doubt whatsoever that this will be accomplished. So what we're doing is we have a transitions in care community of practice. Now, if you aren't familiar with the healthcare community, transitions in care is what we're looking at in terms of when that individual leaves the hospital, where do they go? Traditionally, we're thinking, are they going to home health care? Are they going to the nursing home? But we're looking at it broader than that. Because if you know anything about the healthcare environment right now, you know that hospitals will not be reimbursed. If you are Sylacauga, Coosa Valley Medical Center, and a person enters the hospital with pneumonia, and they are released, and they come in at UAB within a certain period of time with pneumonia, Coosa Valley isn't going to be reimbursed. And not only that, they're going to be penalized, and it may be based on their overall income. Now, can you imagine that? Think about it. It'll bankrupt. It'll bankrupt rural, small hospitals. So there are models. There are evidence. You know, we're all in education about evidence-based models, and there are evidence-based models for transitions in care. So what we are doing as a community of practice, we have, first of all, as our primary partners for the purpose of this Rural Health Network, we have both hospitals. We have East Alabama. Every area of the state is divided into regions, and ours is East Alabama Regional Planning and Development Commission, and they house the area on aging, which a lot of this is going to directly come underneath the umbrella of. And so the area on aging, the 3 superintendents, mental health, because mental health issues our Transitions in Care community of practice has really done a lot of work over the last several months and has actually developed a mission and a vision and goals and where we want to be, and we've established our priorities, and the priority is mental health. In a low-resource, low-tech environment of rural America, there are serious issues related to being able to have access. Psychiatric services. We have a psychiatrist that comes to our county twice a month. It's not mental health's fault. And nobody's pointing the finger at mental health saying you're not doing a good job. What we're saying is we want more of what you got. Mm-hmm. And let me tell you, those relationships have to be nurtured. People don't come, when you start talking about my corner of the world and we need to talk about education, what happens? We close up. What we are communicating is, we need more of what you got. Now that makes me feel a whole lot better, doesn't it? Mm-hmm. Rather than, You're the problem. We need more of what you have. It's all in how we communicate with each other. So we are so excited because actually the community of transitions in care is coming together in a way that we haven't for quite some time. And we've developed some goals. In fact, on Monday, the primary partners are coming together to develop a 5-year strategic plan. It ought to be exciting. And we've already done a lot of the work because we've already done our assessment. We know where we are. We've done our organizational assessments. We've done SWOT. We're going to be doing that with the School and Community Wellness. And so we are positioned to do this work collectively. And we'll stay tuned and see where we go. But and because we are, there are so many more opportunities to bring more resources. Now, let me tell you who's doing the evaluation on this. We've got UAD, School of Nursing and Public Health, that is going to be doing the evaluations through the school and community wellness piece of all this, because we're going to be measuring outcomes for children and adults based on what we're doing along those lines. And they're doing, in fact, the nurses have come in, we've done all across the county, we're doing health assessments to establish some baseline data. And then we are going to be tracking over the course of time. Now, the transitions in care, we also have AUM, their research division of AUM. And they've done a lot of work. I don't know if you have looked at obstacles to opportunities. Are you familiar with this document? It was commissioned by the Business Education Alliance of Alabama and was presented to the state as what would be the economic impact of a 90% graduation rate by 2020. Now, we're talking about a graduation rate that has meaning. College, career, ready. What does it mean? You know what it means? Have you all seen this? Go online to the Business Education Alliance and Google and click on Obstacles into Opportunities. Dr. Kavion Daravi of AUM is an economist, and he is the one that did the research and presented what it would mean. It would mean for every year that we maintain across the board a 90% graduation rate is equal to landing a mega industry like Airbus every year.
Wow.
Now you think about that, because not only does this fuel our economy, it fuels everything that we want to do. Education, we won't be talking about, are we going to take money out of education budget and pull it over into the general fund budget so we can, and what it does, then it takes, Parker took a look at what would it take for us to get to a 90% graduation rate. Well, Department of Ed's 2020 plan is what it will take. Parker is going to measure that every year. Are we making the investments? Are we making the investments? And I can pretty much tell you, you need to be in Montgomery, because are we making the investments? And the investments, if you fast forward over to page 27, Family Resource Centers. Family as part of learning supports, taking school out of the community, out of the schoolhouse doors. Now, there are a lot of other things that we've got to do. Early education. I'm pretty sure you're probably pretty familiar with Department of Ed's plan, but it's start early, set high expectations, break down barriers to learning. That's what the community can help you do. Seek continuous improvement in teaching and leading, which is what you're doing now, and equip every student with a plan for prosperity and a pathway to success. Now, this is a business education initiative.
Wow.
It's not arguable. Now, we have got AUM looking at what will be the impact for the kind of work that we're doing. Now, that includes school and community wellness, transitions in care. One of our other communities of practice is aging and disabled. Now that's going to be continuum of care, folks. There's a difference between continuum of care and transitions in care. We have been engaged because we've been in this business of bringing community together around certain issues and looking at, we have had a prescription medication, access to prescription medication program and education, and looking at people with low literacy. We've had a fever management program for moms who are low literacy and some things of that nature. And one of the things that we did over the course of, we have done over the course of time is to go into the senior citizen centers or work individually with seniors who are polypharmacy. Now polypharmacy means they take 5 medications or more, and who are either low medical literacy or low literacy. Now, I'm low medical literacy because I go into the doctor's office and he tells me you need to do this, 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 and this, and I mean, if I had 5 medications to organize, I would be in trouble. And many of our, not just seniors, many of our folks are in trouble. But at any rate, we spent 2 years going in and educating and developing a relationship with these seniors who were polypharmacy, low literacy, or low medical literacy. And then we evaluated the outcomes for those individuals. We looked at a baseline of how many times were they admitted into the ER or the hospital for an adverse medical reaction. UAB School of Nursing did the study, did the research. It was a 2-year research project. And do you know what we found? We found that not one single individual wound up, that was polypharmacy, low medical literacy, low literacy, wound up in the ER or admitted to the hospital or in ICU for adverse medication reaction. Now you tell me what economic impact that has on the medical community and our economics as well. What does it cost for a person that goes in the ER? Just the ER. $1,000, probably.
At least.
What does it cost if they're admitted into the hospital for an and they're a senior, adverse medication reaction? Or how about ICU? Do you know how much that program cost? About $18,000 a year. Because we were doing it together. So this is the kind of thing that we are so excited about being able to do, but what we have built over the course of time. And what time is it? Okay. I want to leave you with one story because we've got all sorts of outcomes. I could bring you a whole, we have a book that every year we publish, and the wonderful synergy that's surrounding this new approach. It's really not new. It's re-energized approach of bringing people together. We're also looking at how we communicate and that sort of thing. Let me tell you the story of Shakira, and I told you that I was going to. Back in 1998, Shakira's mother, unemployed, 4 children, and living in poverty, generational poverty that we all like to call it, knocked on the door safe. And she came in and she met Linda Burton, who was our case manager for our early intervention program. And Shakira's mom got involved with SAFE. Shakira's mom never got a job. She remained on public assistance and has remained on public assistance. Fast forward, and Shakira's 15 years old, and she's enrolled at Sylacauga High School, and she gets pregnant. Surprised. And she comes to SAFE. Shakira graduates from Sylacauga High School on time. She gives birth to a beautiful baby girl. Shakira graduates from Sylacauga High School, continues to work with Linda Burton at SAFE, goes to Central Alabama Community College, and gets her LPN. She gets a job as a nurse. She She works in a nursing home on the weekends. She works at a clinic in Childersburg during the week. She has advanced herself to supervisor at that clinic. She is in school, getting her RN. Her daughter, last year, graduated from Sylacauga High School with honors and is at junior college at Central Alabama Community College. Shakira, 2 years ago, walked in the door at SAFE with something in her hand. Car keys. She rode public transportation, by the way, for free. She has a car. First car her family, anybody in her family, has ever owned. She has other children, by the way, that are in school, doing well. Last year, she comes back to SAFE with something else in her hand. Keys that open the door of her house. She is a homeowner. She has her own car. She has 2 jobs. Her daughter is successful, and her children are tracking toward graduation. That has changed the cycle of poverty for that family. And that is what this is about. But it wouldn't happen if we don't come together and have a willingness to let go, and let's do it together. And that's what we have done. Now, is it a smooth sailing road? No. Is it always a moving, viable, challenging work? Yes. But it works. It works. And it is working across this state. And I just appreciate the opportunity. It's about capacity and building capacity. And there are all sorts of ways and tools to do that. It just takes getting out there and getting with it. And trust me, there are days you want to pull your hair out and say, I'm not coming back. But it is rewarding and it's making a difference. And so I appreciate the opportunity.
Thank you so much. And of course, we could ask her all these questions, but I'm not going to